Hello and welcome. My name is Dr.Novick. I'm an emeritus clinical professor of dermatology at the Icahn School of Medicine at Mount Sinai in New York. I'm a board certified dermatologist and I have a practice devoted to dermatology and cosmetic dermatology located on the Upper East Side of Manhattan. The subject of this video are skin cancers, the most common kind of cancers of human beings worldwide. The three most common kinds of skin cancers are named according to the cells from which they're derived, located in the epidermis of the skin. Basal cell skin cancer is the most common kind, and it derives its name from the cells in the basement area of this epidermis. The next most common kind are called squamous cells, so they give rise to squamous cell cancers, and they're located in this upper portion of that same layer. And finally, the least common of the three, but certainly the most deadly, potentially deadly of the three, are derived from the melanin-producing cells, the melanocytes, in this basement layer, and that kind of cancer is known as malignant melanoma. The early warning signs of skin cancer are skin growths that may change in size, shape, color, become tender, itchy, bleed, or ulcerate and break down. Particular warning signs when someone is concerned about a birthmark or a beauty mark are what's called the ABCD system. That can be used to help to determine whether something is problematic or not. A normal mole, as you can see, has a nice even border, a nice uniform border. The color across the entire mole is uniform. It's generally like a lighter brown or a reddish brown, but evenly pigmented with a normal border. When there's concern about an abnormal mole or the presence of an abnormal mole, you can use what's called the ABCD system. If you notice, this is not an even border. It's asymmetrical. So that's the A. It's asymmetrical. One side is not the same as the other side. B stands for border. The normal mole, as I showed in the previous picture, a normal mole has a rather even border, but here you can see this border is scalloped. It's far from even. C stands for color. One side is colored very, very dark. The center is colored, lighter. Then there's dark, and there can be a splay of colors. There can be dark browns, very dark browns, black, purple. So there's an intermix. There's a potential intermixing of color in an abnormal mole. And the last sign is diameter. In general, more normal, non-threatening beauty marks and birthmarks tend to be smaller than the size of a pencil eraser, whereas those of malignant melanoma tend to be larger than the size of a pencil eraser, approximately 5 millimeters. Given the widespread nature of the problem of skin cancers, it's very, very important that people participate in their own care by performing these monthly self-examinations that I mentioned. And these include the use of a hand mirror so that all parts of the body can be examined, and it's the best time is after the shower. A completely nude body, and the mirror is used so that you can see areas of the back, the buttocks, between the toes. The scalp can be examined, and it's very, very important to couple this monthly self-examination along with the yearly examination by a dermatologist. Early pickup can prevent disfiguring outcomes and can also be life-saving. And so it's very, very important to incorporate what we discussed into a regular routine of self-checks and prevention. And prevention includes sun protection, because the sun, again to be repeated, is one of the most damaging factors as far as ultraviolet light and solar radiation, and radiation gotten from sun tanning parlors and sunbeds can all be detrimental to the skin. And if any person who's had a great deal of sun exposure in particular should be very cognizant of performing these self-check monthly routines, as well as annual skin physicals by a professional dermatologist. For more information about this or any other subject, you can check out my website, youngerlookingwithoutsurgery.com, or Dr.Novick.com. That's DOCTORNOVICK.com. Thank you.